So if you have pain with you know what, there are a couple different underlying factors that can be going on. So one of the tests that we use to assess for some of these different factors is called a Q-tip test. And we're doing this in order to sort of differentiate between vaginismus, which is more an issue where the pelvic floor muscles are spasming, versus vestibulodynia, which has a lot of other underlying things, but it is usually more when the entrance itself is very painful, usually described as like a burning or a stinging or a sharp type of pain at the entrance. If somebody strictly has vaginismus, you often won't see a ton of sensitivity or burning or stinging right around the entrance, versus someone with vestibulodynia but not really vaginismus. You'll see a lot of that burning, stinging right around the entrance, but not really any tension in the pelvic floor muscles. Now, of course, these will often overlap, so you might see both, but we do the Q-tip test to specifically check in some different spots on the vaginal entrance, and we see if we get any of that burning, stinging, sharp type of pain. So if somebody has a lot of this burning, stinging, sharp pain right around the entrance with the Q-tip test, and they have mostly pain with initial insertion, but then not really pain as it goes farther in, it's probably more on the vestibulodynia side of things, versus someone who has none of that sensitivity around the entrance, but they have a hard time getting things in and a lot of pelvic floor tension, that's going to be more on the vaginismus side.